righty. All right, good morning everybody. We're here this morning for the COVID-19 update for the start of a new week. And we've had a good start to the new week. So over the last 2 days, we have 0 new cases reported in the Murrumbidgee Local Health District, which is great news. I do have to preface that by saying we should have an expectation that our case numbers will go up and down somewhat. But it's great news that what we're seeing is the current clusters in the outbreaks. People have come forward for testing and we are managing to get people into isolation early. So that's been a great response from our communities. So for this particular outbreak in our region, there's been a total of 25 cases to date, bringing a total of 85 cases since the beginning of the pandemic across our region. We have seen a really great response from communities in terms of coming forward for vaccination, and I'm really delighted to say that for the Murrumbidgee Local Health District region and the LGAs, we've now just ticked over the 80% for our region, which is a really fantastic result for people coming forward and having their first vaccination. And we're just close now to 53% for people being fully vaccinated in our region. This is really, really important. We're starting to hear now New South Wales Government talk about easing of restrictions as we go forward. And as we start to see more movement around into regional areas, our best protection is to ensure that we all come forward and get vaccinated, because vaccination, as we know, reduces the possibility of contracting COVID, but more importantly, for people who do, they become less sick and require less hospitalisation. So just last week, the Murrumbidgee Local Health District staff vaccinated over 3,109 people, and we really had a fantastic response in the Deniliquin region, where we've seen a lot of people now come forward after the call to see more people in the Edward River get vaccinated. Also, we had a 53% increase in the number of people coming forward for testing last week. Again, really great responses from Albury, from the people in around the Hilltops region coming forward for testing. And we did 4,722 tests, but combined with all of the private providers, over 10,000 tests were performed in our region. So that is really, really good results. We still, however, have got cases being cared for with COVID-19 in our region. We have 13 people being cared for in our hospital in the home, and we have medical oversight and nursing input into our people who have been cared for in our hospital in the home. Also, really importantly, for people who are in isolation, we need to make sure they've got access to food, access to psychosocial support. It can be very challenging being in quarantine at home. And for people who've got children, we also need to make sure that we're able to provide care and help those families to function. Some of our people with COVID-19 have got other health issues, so we always ensure that we have other specialists who are able to reach in and keep those people healthy while they're recovering from the disease. We have got still people in our special health accommodation, which we have in situ in Albury and also in Wagga Wagga. We still have 4 patients in hospital, although over the weekend we have no patients at the moment in our intensive care unit. So all of our patients are in the COVID ward being cared for by our specialist COVID team. So we had a wonderful vaccination week last week, and we're hoping to do some super things again this week. So to start with, we've got a special super clinic running out of Tolland here in Wagga Wagga, and we've really partnered with community leaders from the Tolland region, and all week we'll be vaccinating there. Also, it's school holidays, so there's a great opportunity for us now to be able to vaccinate our children over 12 years of age. So we're having super school holiday clinics in Wagga Wagga and also in Griffith, and they're walk-in clinics for children and young adults aged 12 to 18 years of age, and they can be accessed from 10 a.m. in the morning till 5 p.m. So that's really great news. For children, though, we do ask that you bring a parent along with you. That's really important, and your Medicare card, please, and come with a face mask. In terms of our staff vaccination, we had a great response with our aged care workers all complying with their vaccination requirements who are currently working in aged care. And of course, under the public health order, we know now that by the 30th of this month, New South Wales Health staff and those working in New South Wales Health licensed private facilities must have had their first dose of vaccination. So we're tracking along well over 91% of our staff to date have come forward for vaccination. There's good access to supply for healthcare workers and our essential services partners, and we're still in negotiations with those who are at the tail end now accessing their first dose of vaccination. And under the order, healthcare workers must then be fully vaccinated by the end of November. So we're tracking along well. And then finally, I just want to talk about our aged care facilities. We are still operating in what we call Code Red, which is when we have outbreak in our region, we have to make sure that we really probably have a very tight control over people who are coming into hospital, because our most vulnerable patients are in hospital. So we have visitor restrictions currently in place across all of our hospitals and also our aged care facilities. It is very, very difficult when you are a resident of an aged care facility not to be able to see your family, your loved ones and your friends. And we're going to extraordinary measures using social media to help connect people. But for families and next of kin who are out there, please contact the manager of your multi-purpose facility or aged care facility and have a talk to that manager about how we can connect families with those aged care residents. It's important for their health and well-being that we keep people connected, and we can, under special circumstances, undertake a risk assessment so that we can provide some connection for our aged care residents with their families. They are a very, very vulnerable population group, and we want to look after them, not only, I guess, in protecting them from the disease, but also look after their well-being as well. So that's pretty much the update from me. I'm going to hand over now to my colleague, who I think is Acting Superintendent Winston Woodward. Thank you.
Good morning. Detective Acting Superintendent Winston Woodward from the Riverina Police District. I think what will be a focus of us coming into this weekend and a long weekend will be licensed premises and alcohol consumption. Last weekend I saw 4 of our officers assaulted. 1 officer was assaulted twice in the same shift, which is not acceptable, and I think, as we all know, alcohol impairs our judgment, but please don't let alcohol impair your judgment not to abide by the New South Wales health orders in relation to COVID. You can see some silly choices being made. The good work that's been done so far to get us to this stage is very appreciative, and I'm appreciative of the community for doing the right thing. But do not go out to licensed premises, drink excess alcohol, come out onto the street or in the licensed premises, not abide by the health regulations, and also get partaking in violent antisocial behaviour. Because not only will you come undone in relation to alcohol offences, you will also get the tickets for not abiding by the New South Wales health orders. Our officers will be out and about across the district, and I'm just pleading with everybody to keep us all safe, and by all means go out and have a drink and enjoy yourself, but please abide by the health regulations.
Can you give some clarity on the 4 officers that were assaulted? So they were doing COVID compliance and then had some backlash, is that what happened?
No, it is, I should clarify on that, it was in relation to alcohol's involved and all, and we can see that the opening up, we're slowly coming to open up, and people have been in lockdown in various different places, and I can understand that, and people might want to blow off some steam, but we've got to do it responsibly. Our officers are not punching bags, and if you assault a police officer, you will get a court date. But I don't want to see that. It's, police have families, they have friends, they want to go home safe at the end of the day. And we've seen some awful stuff coming out of Sydney, and you can see some awful stuff coming out of Melbourne. We don't want any of that here in the Riverina PD, and I condone all of that. I think it's sad that alcohol can impair your judgment so bad that you end up going home either in the back of a police van or to the station. You get some charges, you get a court date. So please keep each other safe. We've done such a good job. It'll be a shame to let our guard down now.
And are they minor injuries to those officers, or are they?
Yeah, common assault, bumps and grazes, and but it always rocks a person's confidence when they become a victim of an assault.
Are you able to shed some details around what happened to the officer who got assaulted twice? Was that by the same person? Are you able to just share some of the circumstances around that one?
Two different jobs. Unfortunately, two different jobs, and I know police expect this, but yeah, you don't expect to come to work, go to two different jobs and deal with people and end up the victim of an assault.
In terms of public health order compliance, I guess what is the main issue that police are seeing in the Riverina Police District? Is it people not wearing masks when they should, or perhaps not obeying the social distancing rules?
The main one we're seeing at the moment is QR, abiding by QR, and it's very hard for local businesses, and I understand what they say totally in relation to how do we police people coming through our front doors and using the QR code. The bottom line is the owner of a business can refuse right to anybody who doesn't abide. You know, that owner of that business has to keep his staff safe and his other customers safe. I advise everybody, if somebody doesn't want to abide by your direction, to can you please QR code in. Don't get in an argument with them and come into a violent confrontation. Call us. We can come down and issue appropriate penalty notices if that person. The only other issue we're having at the moment, I suppose in numbers, is not wearing a mask indoors, as your shopping centres, supermarkets, things like that. Please wear a mask when you're indoors and try to keep everybody safe.
Winston, do you have any numbers on the infringements you've handed out in the last week or so?
I do, but I can't comment too much on numbers. I don't like to go into numbers. I just think people just need to be a bit more patient, a little bit longer. Don't drink to excess, and just have a good time while you're keeping everybody safe.
And we're in school holidays as well now. Have we seen anything being done wrong on the roads, or people being in the wrong places, anything like that?
I think we've done all right. As you're aware, it's no longer double demerit points this weekend. I think the Minister has said that we're only going to abide by normal demerit points. And can I just say on that, just because the Minister has said that it's not double demerits, we are going to be out in force. You are still going to get drug tested, you're still going to get breath tested, and you're still going to get that ticket which carries demerit points if not. It's not that we're not going to be around. Highway Patrol, Riverina Police District Police will be out in force this weekend.
Will the long weekend operation sort of be a bit of a joint target, sort of targeting those normal offences we see in our roads, but also people breaching public health orders? It'll be a bit of a...
Always. Our RBT sites and everything is geared up to combat both.
I think that was more questions for Jill, if possible. Okay. So just about these pop-up clinics, Jill. So what is the main, I guess, message behind it with the 12-year-olds getting vaccinated, 12 to 18-year-olds, and then also the Tolland one? Can you just clarify some stuff there?
Sure. So we're really trying to, I guess, work around people being vaccinated easily. So we all know that making appointments through the Commonwealth database does require a degree of patience. So we have moved towards providing a lot more pop-up walk-in clinics, which just makes it easier for people to come at a time that suits themselves. So the work that we're doing at Tolland is in collaboration with the community centre there and some of the community leaders who are providing access to transport for people who might not normally be able to get around and access vaccination clinics in the traditional model. So we're taking vaccine to the people. I think that's really important, particularly for some of our vulnerable population groups who might have had long periods of at home, don't have access to a car, and might find going onto a website and booking in for an appointment somewhat challenging. Likewise for children, it's school holidays now and we've seen a really great response. We did some extended clinic hours last week across the district and we saw a majority of people coming forward in the afternoons in that 12 to 18-year-old age bracket. So given it's school holidays, we thought let's start off with an opportunity to really boost those numbers of students in that age bracket. And again, a shout out to anybody who's doing the HSC this year. Really important for you to come forward and get your vaccination early.
And I guess how important is it for them heading back to school next week to have that added protection especially as we open the state up next term?
Yeah, and look, we've seen a fantastic uptake right across the state of children in that 12 to 18-year-old age bracket. There's been an extraordinary number of children vaccinated, and I think kids want to go back to school. They want to catch up with their friends, but it is important, together with the Department of Education, that we provide a COVID-safe environment for children when they're at school, and certainly vaccination and making sure that children don't go to school if they're symptomatic is very, very important around keeping our schools open.
I know you touched on it earlier, but you mentioned Deniliquin and the uptake of vaccination down there. I think there was a Super Saturday event. Are you able to give any data or numbers, I guess, on how many people went through the vaccination clinic?
I can, if I get my notes, I can tell you the number, which I just left over here. And look, I think we're working with the Primary Health Network around the data for Edward River. We have seen a really fantastic amount of work being undertaken by many people, particularly in the Deniliquin area, around vaccination. So the Primary Health Network are going to have a look at the Commonwealth data and look to see what the actual percentage numbers are there. So I have sought some clarification and hope that they can provide some additional information for us. So in Deniliquin, actually I don't have the data here, but can you provide it, Sechin, at some other point? So I don't think I've got it in front of me yet.
So just what you were saying there, Jill, with seeking that clarification, is there a concern that perhaps the data isn't correct and perhaps the vaccination status in Edward River isn't as bad, I guess, as the numbers are showing currently?
And look, there are 3 regions in the Murrumbidgee area where we have got lower vaccination rates: Junee, Carrithul and Edward River. And certainly in Junee and Carrithul, we're working with the respective councils there to provide some assistance along with the GPs in terms of pop-up clinics. But the Edward River, the data, we're just going to ask for the Primary Health Network to have a look at it and come back to us because the data is not making a lot of sense. So what we really want to see is the data now for the over 12-year-old population who are eligible for vaccination, seek some clarification there.
And how soon do you expect to have that clarification?
I think we should get some clarification within the week, because I've seen varying percentage rates for the Edward River and I'm really keen that we get some clarity, particularly for people who live in that region.
Sorry, you go.
No, you're welcome to give that.
I know there was some concern over the weekend with the Pfizer walk-in clinics and perhaps not the numbers that you were hoping to see there. Do you think that's a case where people have perhaps gone to access AstraZeneca because it was available earlier and now there isn't that need for the Pfizer, or what do you think is the reasoning behind that?
Oh, look, I think there were 2 reasons why we had a bit of a slower weekend. I think one of the reasons is it's school holidays and people were sort of had their mind on other things. But I think the big footy weekend was probably the real reason. There were a lot of people who were sitting around in front of their tellies on Saturday and having a bit of a barbecue and a celebration on Sunday. So I think it's really just the circumstances. And we will see things go up and down. And I have now got the data of the number of people who were vaccinated in Deniliquin last week, which Sechin's provided me. So we vaccinated 1,908 people through our Deniliquin vaccination clinic to date. So that's really great data. Yep.
Jill, I just wanted to ask a couple of questions about contact tracing. Obviously, a lot of people in the community don't really understand how it works. Can you just explain to us, I guess, the complexities around it and why it can take, such a long period sometimes to get those exposure sites and those cases out to the public?
Yes, thank you. And we have a public health unit located here in the Murrumbidgee region, and they look after all of the public health contact tracing and infectious diseases management for all of the southern part of New South Wales. And they have a team of contact tracers and other people who are specialised in other areas of public health. So when somebody has a COVID test, the results come into a New South Wales data system and are allocated out to a contact tracer. That can happen very quickly, and once the notification is made, then the contact tracer then needs to make contact with that person. And it's great if they have left a mobile phone number or a landline that is right, but there are occasions sometimes where we are unable to make immediate contact with that person, in which case we work very closely during a pandemic with our colleagues in the New South Wales Police Force, and they assist us sometimes in locating people. Also, sometimes people, if we can't get them by the phone, we try to get them at their address, and sometimes people's addresses are not correct in the system. But for the majority of people, once we make contact with them, one of the first things we do is check in to make sure that they're receiving clinical care. So the clinical care starts at the same time that the contact tracing starts, so that we don't have any delay. And we have to understand that people who have COVID are sick and might not be feeling 100%. So the interview that our surveillance officers hold with our new cases takes at least an hour, where they need to go through and have a discussion with that person to establish when they first became infectious, where they are up to in the COVID disease cycle, and then going back and understanding whilst they were infectious, where were they in the community. And commonly what happens in the majority of cases are that whilst we can access the QR code data separately, people will sometimes remember later other places where they might have been. For example, if they visited a family member or a friend. And so sometimes we get people ringing up several times saying, I've just remembered that I went to this place. And it's really hard, actually, if you try and think about where you have been in the last 7 days, to be able to accurately put that forward with the timeframes that we need. The other thing is we only publicise venues of concern if we feel that we need to give that information to the public, because there may be people who were there that we don't know about. If there is a venue where somebody has been at where we feel there is no risk to the public, we will not necessarily publicise that if we are certain that nobody else from the public has been in contact with the person while they're at that venue.
And lastly, just on that topic, you touched on it there, but obviously forgetfulness can happen in terms of people feeling unwell. Has there also been cases where people haven't wanted to provide information, or has it been, quite good in terms of people cooperating with that?
Look, the majority of people are happy to assist because they want to make sure that the infection rate is slowed. Occasionally we've had difficulty locating people, and that's really just been that the person has had the test outside of the region and is actually not in the Murrumbidgee region, and sometimes it can take us 24 hours or so with our police colleagues to assist us in locating the person. So far we haven't had many people who are non-compliant around not wanting to assist us. And we appreciate that we are not here to judge, we are not here to report people to the law. We really just want to know where people were, and we want to put measures in place so that we reduce the amount of infection that can happen in the community. So we take a very holistic approach. We also try and help people if they are worried that they don't have what they need to isolate appropriately. We do an environmental check of their home, and if they don't have a home that's suitable for isolation, then we offer them alternative accommodation with support. We offer food hampers. There are lots of issues around pets and feeding pets and all sorts of things that our public health officers, together with our hospital and the home team, probably spend 70% of their time looking after the holistic needs of the person in isolation, not just the clinical needs as well.
I understand in the last few days there's been a change when it comes to positive case identifications, that it's now by LGA rather by town name, which is what we've become used to over the course of the pandemic. Can you just explain what the reasoning is behind that shift?
I think it's really important that we protect the confidentiality of people who are diagnosed with COVID-19, and in rural areas where we have low case numbers, there is a risk that people's identity can be leaked out. So that's why we are really reporting the numbers by LGA to protect the confidentiality of our cases.
Have there been incidents locally where that has been a case where a person in a local community has been targeted or ostracised as a result of a positive diagnosis?
Look, it's been a constant issue ever since the beginning of the pandemic across our region, and we will go to extraordinary lengths to keep the identity of people confidential. It's part of our responsibility. So we will be only talking about LGAs in an effort to keep that confidentiality.
The source of the first case in Young still hasn't been found as well, and I've heard that genomic sequence testing has been brought in to find where that has come from. Could you just talk to us about that?
So we have made a request to New South Wales Pathology to undertake genomic sequencing to link, I guess, that first case, or to find the index case and link it to a cluster elsewhere in New South Wales. So we're still awaiting the results. It's quite a long, complex process that takes a lot of scientific work, so I'll certainly let you know once we get the results back.
So do we think that case is from another area in New South Wales, or could there possibly be another person in Young with the virus that we're not aware of yet?
So our thinking is that it is linked with another cluster somewhere in New South Wales, yes. Yep, and we're just going about proving that now. Yep.
Premier announced this morning, obviously a bit more clarity around the roadmap out of this once we hit 70% and 80%. I guess, is MLHD pleased to have some clarity around what it's going to look like when we hit those targets?
Well, I think everybody is striving to get clarity to understand how we're going to live our lives into the future and to get some of what we've lost back again. And so long as we have got plenty of notice and that we've got the clarity around the rules, then I think everybody can move forward together. When you think about what we've been through in the last 18 months and how quickly things have changed, we have asked a lot of people, and people are, I think, a little bit fatigued now with the different messaging that we're hearing. So I think it's great news that we're getting clarity on our future, and it's really great for businesses. Businesses need the clarity now, and people who have been working from home, children who've missed out on a lot of school, everybody now needs that clarity for our well-being. The pandemic has had a toll on causing distress in people, and particularly young people who are often the ones who have not been able to maintain their employment. So I think clarity is absolutely essential to us moving forward and our well-being.
I know the state government has announced a couple of dates this morning that they're working towards with those vaccination rates. Are you confident that when those dates roll around that locally vaccination will be at a place where you're confident to have people sort of coming and out of the region, moving into the region and coming and just having, I guess, that more freedom of movement? Will vaccination rates be at a level that you're comfortable with when we start seeing a lot more movement happening?
I can appreciate that people in regional areas and in our area are hesitant about opening up and people coming from larger centres where there are higher rates of COVID-19 in the community. It is quite natural, I think, for us to feel concerned, a little bit fearful about that. And so vaccination is absolutely critical for us and for our safety. And we have over 100 providers of vaccination across our region now, and Moderna is now available as of this week across our region, and our pharmacists are all geared up to also provide vaccination with a number of different vaccines. And we've also seen an improvement in the supply of vaccines coming forward. So I think with the combination of our pharmacists, our GPs, and where we are going in and doing pop-up clinics in areas where we need that boost and that acceleration, that is how we will reach our targets. And we've seen just in the last, I was looking at the data, in 1 month we have seen an extraordinary increase in the percentage vaccination rates across this region. People are coming forward for vaccination. It is easier now to understand eligibility. Anyone over 12, you can get vaccinated. There's lots of walk-in options for people, and I think the fact that we're making it easier is going to help us hit those targets.
They have said that cases will rise when everyone is opened up again. Are we sure that our health system is okay and ready for when that influx of cases does eventually come?
Our health system does need to be ready for COVID disease to be long-term in our region. We know that we're going to see the case numbers fluctuate up and down, and when we open up, we do need to be ready for an increased number of cases should that occur. So I am confident that we have scalable COVID services in the community, in our hospitals and in our intensive care units. We're doing refresher training all the time to make sure that, particularly in intensive care and in our COVID wards, that staff are continuing to receive that additional education should we need to surge the workforce. So I'm confident that we have the capacity in the health system to be able to care for people in the region.
Jill, just quickly, you said there were 4 cases still in hospital, so has one recovered and gone home? Because there was 5 initially, so we've seen one leave and then one come off.
That's right. Yes, we're starting to see some of our original cases recovering now, and yes, there has been a discharge from hospital.
Good.
Thank you.
Thank you.
Thank you.
Jill, are you with me just to get a photo of you to go with the story?
Sure. Do you want it with